Hi, ako si Francesca Inisla English from BIT2T FSMA. Nandito ako ngayon para i-discuss sa inyo ang napili kong topic. At ang napili kong topic ay abortion. Bago ako magsimula, ano nga ba ang abortion? Abortion ay mas kilala dito sa atin bilang pagpapalaglag. Ano nga ba to? Ang abortion o pagpapalaglag ay ang sinadyang pagtatanggal ng embryo o fetus sa loob ng matres ng babae na nagsansanhi ng kamatayan ng sanggol. Pwede itong mangyari ng biglaan tulad ng kapag ang babae ay nakunan o ang parehong buhay ng ina o sanggol ay manganganib. Ito ay pinapayagan sa mga kaso ng panggagahasa, insesto sa isang babae na nanggahasang kamag-anak, at hindi pinlanong pagbubuntis, o kung ang mga fetus ay may mga sakit na maaaring makaapekto o magdulot ng hirap sa magulang o sa isisilang na sanggol. Ang abortion ay may dalawang pangunahing opsyon. Pagpapalaglag gamit ang gamot at ang mga pamamaraang klinika. Ang iyong option ay maaaring mag-iba batay sa yugto ng iyong pagbubuntis at sa provider na iyong pinili. Una dito ay ang pagpapalaglag gamit ang gamot. Ang pagpipiliang ito ay kilala rin bilang ang abortion pill. Kahit na talagang nangangailangan ito sa iyo na kumuha ng ilang mga tabletas, ang pagpapalaglag na gamot sa pangkalahatan ay isang pagpipilian hanggang sa 10 hanggang 11 na linggo mula sa unang araw ng iyong regla. Magagamit pa rin ang mga pampalaglag na gamot sa California, habang ang isang desisyon ng korte ng federal ng distrito ay naglalayong paghigpitin ang pag-access sa mifepristone. Maaari ka pa rin makakuha ng misoprostol o abortion na parehong ligtas at epektibo. Matuto ng higit pa tungkol sa access sa pagpapalaglag ng gamot sa California. Paano nga ba umiepekto to? Ang pampalaglag na gamot ay kapag kumuha ka ng ilang mga tableta hanggang sa 48 oras ang layo, ay maaari kang kumuha ng gamot sa isang klinika, sa bahay, o saan ka man mananatili. Kumuha or mag-take. Ang pampalaglag na gamot ay maaaring tumagal ng ilang oras hanggang ilang araw upang makumpleto. Ang haba ng oras ay nag-iiba mula sa tao hanggang sa tao at depende sa uri ng mga gamot na ginamit nito. Meron akong example ng video na nagpapaliwanag dito tungkol sa abortion pill. Panoorin niya.
Around the world, people are more and more often choosing medication rather than a clinical procedure to end unwanted pregnancies. Pill-based abortions now account for more than half of all abortions in the US, and that figure is even higher in other countries. So what are these medications, and how do they work? Globally, the most common medication used to end pregnancies is called misoprostol. Misoprostol was originally developed to treat ulcers, since it interacts with the muscular lining of the stomach and affects the secretion of important stomach fluids. But misoprostol also interacts with the muscular lining of the uterus, and there it causes contractions, which can push out everything inside. When taken during the first 10 weeks, misoprostol alone will end a pregnancy about 90% of the time. Misoprostol can also be used in combination with another medication called mifepristone, which was originally called RU486. Mifepristone works by interfering with the pregnancy hormone that normally keeps the lining of the uterus thick enough to support a growing embryo, and keeps the cervix, the opening to the uterus, closed off. By binding to the hormone's receptors, mifepristone blocks the hormone from doing those jobs. As a result, the uterine lining starts breaking down, causing the embryo to detach, and the opening to the uterus starts softening, making it easier for contractions to push out everything inside. Mifepristone, the hormone blocker, isn't all that effective at ending pregnancies on its own. But because it has such a different mechanism from misoprostol, the contraction causer, the two medications are really effective together. If taken during the first 10 weeks, these two types of pills in combination will end the pregnancy more than 95% of the time. Pill-based abortions can be pretty painful and cause a lot of bleeding. After all, what these medications are doing is causing a miscarriage. Medical professionals can't actually tell from symptoms alone whether someone is having a natural miscarriage or a pill-based abortion, since the physiological process is exactly the same. In fact, doctors routinely prescribe mifepristone and misoprostol to people in the midst of miscarriages, since they can help the tissue detach and pass out of the body more quickly and safely. When taken according to instructions, these medications are a remarkably safe way to end a pregnancy. Most of the bleeding and discomfort resolve on their own within a day or two. A very small percentage of people do experience complications, like they lose too much blood, or their body doesn't pass all the pregnancy tissue. And in these rare cases, emergency medical care is a must. But most pill-based abortions can, in principle, take place at home without on-site medical supervision. Right now, whether or not a person can legally use these medications to end a pregnancy depends on how long they've been pregnant and where they live. For more information, check out the resources in the description.
Abortion. Abortion is the termination of pregnancy or the loss of a fetus embryo. The rate of miscarriage risk is high at the start of pregnancy. Mostly, miscarriages happen in the first trimester, that is, the first 12 weeks of gestation period. The earliest weeks of pregnancy, before the 20th week, is the time when a woman is at the highest risk of a miscarriage. The risk starts to drop when pregnancy reaches the 6th week. It is better to keep in mind that complications can arise at any point in the whole pregnancy period. Classification of abortion. Early abortion. It is the removal of undesired tissues in the first trimester in the 10 to 14th week of confirmed pregnancy through pills. Late abortion. The abortion after the 24th week of pregnancy is called late abortion. Spontaneous abortion. The death of the fetus before 20 weeks of pregnancy is spontaneous abortion. Causes of spontaneous abortion. It can happen due to multiple reasons. There are no specifically mentioned causes. A spontaneous abortion does not mean it was caused by something you did. A list of problems that result in spontaneous abortion given by Daily Medicos are several viruses such as cytomegalovirus, herpes virus, parvovirus, and rubella virus. Chromosomal and genetic abnormalities. For chromosomal and genetic abnormalities, there comes intrauterine fetal demise, stillbirth, blighted ovum, no embryo formation, molar pregnancy, no fetal development, partial molar pregnancy. Defects in phases also cause miscarriages. Immunologic abnormalities, major trauma, uterine abnormalities like fibroids, adhesions also cause spontaneous abortion. Placental defects, retroverted uterus, cervix problems, hormonal problems in mother, infections, uncontrolled diabetes, thyroid disorders, abnormal fetal growth. These errors in genes and chromosomes of the mother or father can occur naturally and promote no fetal growth. Damaged cells, embryo division, or damaged sperm cells are also natural causes of abortion. Induced abortion. The intentional removal of embryo in case of unwanted pregnancy is induced abortion. Threatened abortion. Threatened abortion is marked by vaginal bleeding that occurs in the first trimester, which could be a sign of possible miscarriage. Inevitable abortion. The symptoms of inevitable abortion are intrauterine pregnancy with worse cramps, high vaginal bleeding, and cervix dilation that results in miscarriage. Complete abortion. Complete abortion happens during the 8th week when all the tissues leave the body and pass through the vagina with bleeding. Incomplete abortion. When some of the tissues leave the body and some products stay in the body, this is incomplete abortion. Recurrent abortion. 3 consecutive miscarriages in 20 weeks is considered as recurrent pregnancy. Missed abortion. When the fetus didn't form and has died but the tissues remain in the uterus is missed abortion. Septic abortion. A uterine infection can spread to the placenta and fetus before and after induced abortion and can develop sepsis in the uterus, placenta, fetus, and vital organs. Risk factors involved in abortion. Risk factors of spontaneous abortion can be avoided to prevent abortion or miscarriage. Certain risk factors that could lead a woman to miscarriage are: risk factor of abortion increases with age greater than 35. History of spontaneous abortion. Tobacco consumption. Use of alcohol, drugs, that is cocaine. Chronic disorder in the mother, that is diabetes, hypertension, overt thyroid disorders. High caffeine intake. Uterine and cervix problems. Excess weight. Invasive prenatal tests. Poor diet or malnutrition. Advanced maternal age. Abnormally shaped uterus. Severe high blood pressure. Food poisoning. Exposure to toxins like arsenic, lead, etc. Use of certain medications. Prevention of miscarriage. Some tips for avoiding a miscarriage are: regular exercise like jogging, walking, or cycling. Regular prenatal follow-ups. Avoid smoking, drug use, and alcohol intake. Intake of prescribed multivitamin. Limit caffeine intake during the pregnancy, but it's better to avoid it. Maintenance of a healthy weight. A healthy and balanced diet with all nutrients and minerals in every meal. Avoid things that might develop infections. Add fruits and vegetables in your daily diet. Maintain a happy and calming environment. Find ways of managing your stress. Diagnosis, confirmation of abortion. The tests that are carried out for diagnosis and confirmation of abortion are transvaginal ultrasonography, transabdominal ultrasonography, serum HCG tests. Treatment of abortions. Commonly for women who have an abortion except complete have 3 treatment managing options. Expectant management. Doctors wait for the rest of the tissue to pass out naturally in this type of treatment. Medical management. This treatment option requires medicines to remove the remaining tissue out of the body. Surgical management. This treatment option requires a surgical procedure to remove the tissues remaining, if any.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.
Sa nakita nyo natapos ng video, ay pinapakita doon na mas maraming tao ang nagtatangkilik o mas prefer nila yung abortion pill. Mas maraming tao yung mas prefer yun. Kahit naman dito sa Pilipinas, madami din tao na mas tumatangkilik noon kahit sabihin mo pa natin na illegal talaga. Illegal yun dito sa ating bansa. Dahil ayun ang pangkaraniwang pampalaglag na alam ng karamihan ng tao dito. Na kaya kahit illegal to ay hindi pa rin maiiwasan na marami pa rin tao ang nagbebenta nito at marami pa din ang tumatangkilik nito, lalo na sa online platform. Marami kang makikita na may mga posts na naghahanap ng abortion pill at meron ding mga taong madami din tao ang nag-o-offer nito na mga nagtitinda. makikita din natin sa video na effective din yung abortion pill na may gamot na misoprostol at mifepristone. Ngunit magsasanihi pa rin to sa taong nag-take nito ng lubhang pagkasakit at pagdurugo na nagtatagal ng umaabot ng ilang linggo. Ngunit nasabi din naman sa video na safe to at merong pag-aaral tungkol doon. Ngunit kahit na madami nagtatangkilik ng abortion dahil sa mga taong hindi pa handa o ano man ang dahilan nila, ay mananatili pa rin itong illegal sa Pilipinas batay sa Article 256, 259 ng Act Number 3815 1930 o Reverse Penal Code. Ipinagbabawal ang anumang uri ng pagpabalaglag at anumang tulong mula sa tao nasa medical na propesyon. Bagamat ipinagbabawal, mayroon pa rin bumibili ng pampalaglag. Labag man sa batas dito sa Pilipinas ang pagpapalaglag, ganun din sa simbahan Katoliko na nagsasabing ang pagpili sa abortion para sa pansarili mong kapakanan o katayuan sa lipunan ay salungat sa kalooban ng Diyos. At ang mga miyembro ng simbahan ay sang-ayon dito. At ang mga tao namang sumasang-ayon na tamang pagpapalaglag na miyembro ng simbahan ay maaaring tanggalin sa pagiging miyembro nito. Kanina pinakita ko sa inyo ang video na halimbawa ng abortion na ang abortion field. Ngayon naman ay ipapakita ko sa inyo naman ang isa pang uri ng abortion na tinatawag na clinical abortion na kadalasang ginagawa sa clinic.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician-gynecologist, and I performed over 1,200 abortions. First, I'm going to describe a first trimester medical abortion. This is a procedure in which the mother swallows pills in order to terminate her baby, and it is performed up to the 9th week of pregnancy. The procedure involves 2 steps. Step 1. At the abortion clinic or doctor's office, the woman takes pills which contain mifepristone, also called RU46. RU46 blocks the action of a hormone called progesterone. Progesterone is naturally produced in the mother's body to stabilize the lining of the uterus. When RU46 blocks progesterone, the lining of the mother's uterus breaks down, cutting off blood and nourishment to the baby, who then dies inside the mother's womb. It is important to note that even after it has been taken, it is possible to reverse the effects of RU46 and save the baby if progesterone is administered. The sooner, the better. Step 2. 24 to 48 hours after taking RU46, the woman takes misoprostol, also called Cytotec, that is administered either orally or vaginally. RU46 and misoprostol together cause severe cramping, contractions, and often heavy bleeding to force the dead baby out of the woman's uterus. The process can be very intense and painful, and the bleeding and contractions can last from a few hours to several days. While she could lose her baby any time and anywhere during this process, the woman will often sit on a toilet as she prepares to expel the child, which she will then flush. She may even see her dead baby within the pregnancy sac. At 9 weeks, for example, the baby will be almost an inch long, and if she looks carefully, she might be able to count the fingers and toes. After she has disposed of her baby, the woman may have bleeding and spotting for several weeks. Bleeding lasts, on average, 9 to 16 days. 8% of women bleed more than 30 days, and 1% require hospitalization because of heavy bleeding. RU46 is only FDA approved for the first 7 weeks of pregnancy. While RU46 can be used off-label up to 9 weeks, the failure rate increases as the pregnancy progresses. At 7 weeks, it has a 5% failure rate. At 8 weeks, an 8% failure rate, and at 9 weeks, a 10% failure rate. If failure occurs, she will usually be offered a surgical abortion. For the mother, medical abortion often causes abdominal pain, nausea, vomiting, diarrhea, headache, and heavy bleeding. Maternal deaths have occurred, most frequently due to infection and undiagnosed ectopic pregnancy. First trimester surgical abortion called suction D&C, dilatation and curettage. This is the most frequently performed abortion and is used typically from 5 to 13 weeks of pregnancy. After administering anesthesia, the abortionist uses a speculum like this. This is placed inside the vagina and opened using this screw on the side, allowing the abortionist to see the cervix, the entrance to the uterus. The cervix acts as a gate that stays closed for the duration of pregnancy, protecting the baby until it is ready for birth. The abortionist uses a series of metal rods called dilators, like these, which increase in thickness, and inserts them into the cervix to dilate it, gaining access to the inside of the uterus where the baby resides. The baby has a heartbeat, fingers, toes, arms, and legs, but its bones are still weak and fragile. The abortionist takes a suction catheter like this one. This is a 14 French suction catheter. It's clear plastic, about 9 inches long, and it has a hole through the center. It is inserted through the cervix into the uterus. The suction machine is then turned on with a force 10 to 20 times more powerful than your household vacuum cleaner. The baby is rapidly torn apart by the force of the suction and squeezed through this tubing down into the suction machine, followed by the placenta. Though the uterus is mostly emptied at this point, one of the risks of a suction D&C is incomplete abortion. Essentially, pieces of the baby or placenta left behind. This can lead to infection or bleeding. In an attempt to prevent this, the abortionist uses a curette to scrape a lining of the uterus. A curette is basically a long-handled curved blade. Once the uterus is empty, the speculum is removed and the abortion is complete. The risks of suction D&C include perforation or laceration of the uterus or cervix, potentially damaging intestine, bladder, and nearby blood vessels, hemorrhage, infection, and in rare instances, even death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. Second trimester surgical abortion called dilatation and evacuation, or D&E. A D&E is performed between 13 and 24 weeks of pregnancy. After administering anesthesia, the abortionist uses a weighted speculum, like this one, that opens the vagina widely. Because second trimester babies are so large, this greater access facilitates a late-term abortion. Late-term abortion requires that the cervix be prepared 24 to 48 hours in advance with laminaria. Laminaria is a type of sterilized seaweed that absorbs water over 8 to 12 hours and swells to several times its original diameter. Once removed, metal dilators can be used to further open the cervix as needed. Once the cervix has been stretched open, the suction tube is placed inside. A baby at 20 weeks gestation is as big as the length of my hand, from head to rump, not counting the legs. The suction machine is turned on, and pale yellow amniotic fluid surrounding the baby is suctioned out through the catheters. But babies this big, they don't fit through catheters this size. The baby's bones and skull are too strong to be torn apart by suction alone. This is a Sofer clamp. A Sofer clamp is made of stainless steel. It's about 13 inches long. The business end is about 2.5 inches long and a 1/2 inch wide, and there are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. The abortionist uses this clamp to grasp an arm or leg. Once he has a firm grip, the abortionist pulls hard in order to tear the limb from the baby's body. One by one, the rest of the limbs are removed, along with the intestines, the spine, and the heart and lungs. Usually the most difficult part of the procedure is extracting the baby's head, which is about the size of a large plum at 20 weeks. The head is grasped and crushed. The abortionist knows he has crushed the skull when a white substance comes out of the cervix. This was the baby's brains. The abortionist then removes skull pieces. He removes the placenta and any leftover parts of the baby with a curette, scraping the lining of the uterus for any remaining tissue. The abortionist then collects the baby parts and reassembles them to make sure that there are 2 arms, 2 legs, and all the pieces. Once all the parts have been accounted for, the abortion is complete. For the woman, this procedure carries a significant risk of major complications, including perforation or laceration of the uterus or cervix, with possible damage to the bowel, bladder, and other maternal organs. Infection and hemorrhage can also occur, which can even lead to death. Future pregnancies are also at greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. Finally, I'm going to describe a 3rd trimester induced abortion, which is performed at 25 weeks to term. At this point, the baby is almost fully developed and viable, meaning he or she could survive outside the womb if the mother were to go into labor prematurely. Because the baby is so large and developed, this procedure takes 3 or 4 days to complete. On day 1, the abortionist uses a large needle to inject a drug called digoxin. Digoxin is generally used to treat heart problems, but a high enough dosage of digoxin will cause fatal cardiac arrest. The abortionist inserts the needle with the digoxin through the woman's abdomen or through her vagina and into the baby, targeting either the head, torso, or heart. The baby will feel it. Babies at this stage feel pain. When the needle pierces the baby's body and the digoxin takes effect, the life of the baby will end. The abortionist then inserts multiple sticks of seaweed called laminaria into the woman's cervix. They will slowly open up the cervix for delivery of a stillborn baby. While the woman waits for the laminaria to dilate her cervix, she carries her dead baby inside of her for 2 to 3 days. On day 2, the abortionist replaces the laminaria and may perform a second ultrasound to ensure the baby is dead. If the child is still alive, he administers another lethal dose of digoxin. The woman then goes back to where she is staying while her cervix continues to dilate. If she goes into labor and is unable to make it to the clinic in time, she will give birth at home or in a hotel. In this case, she may be advised to deliver her baby into a bathroom toilet. The abortionist then comes to remove the baby and clean up. If she can make it to the clinic, she will do so during her severest contractions and deliver her dead son or daughter. If the baby does not come out whole, then the procedure becomes a D&E, a dilation and evacuation, and the abortionist uses clamps and forceps to dismember the baby, piece by piece. Once the placenta and all the body parts have been removed, the abortion is complete. Late-term abortions have a high risk of hemorrhage, lacerations, and uterine perforations, as well as a risk of maternal death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions. One day, after completing one of those abortions, I looked at the remains of a preborn child whose life I had ended, and all I could see was someone's son or daughter. I came to realize that killing a baby at any stage of pregnancy for any reason is wrong. I want you to know today, no matter where you're at or what you've done, you can change. Make a decision today to protect the preborn. Thank you for your time. I will no longer do any more abortions. When you finally figure out that killing a baby that big for money is wrong, that it doesn't take you too long to figure out it doesn't matter if the baby is this big or this big or this big or maybe even this big, it's all the same. And I haven't done any since then, and I never will.
Makikita sa natapos na video ang mga gamit para sa pag-abortion at ang proseso kung paano ito ginagawa. Madami man ang nagsasabing hindi tama ang abortion, lalo na dito sa ating Pilipinas, simbahang Katoliko, tungkol dito at ang ating batas. Ngunit marami pa ring tao ang tumatangkilik dito, lalo na ang mga taong hindi pa handa, lalo na ang mga kabataang nagbuntis ng minor edad na wala pa sa tamang edad at natatakot sila na mahusgahan ng ibang tao at kaya napupunta na lang sila sa desisyon na abortion dahil doon. dahil hindi pa din sila handa sa ganong klaseng responsibilidad. Hindi naman mga nagsasabi na kasama to bilang karapatang ng tao na magdesisyon ka ng sarili mo at gawin, may kalayaan kang gawin kung ano man ang gusto mo, ano man desisyon ang gusto mo. Ngunit dito sa atin ay illegal talaga to. Itinuturing na labag sa batas ang pagpapalaglag o abortion dito sa atin sa Pilipinas. Iba-iba ang dahilan ng mga Pilipino sa pag-itil sa buhay ng sanggol sa kanilang sinapupunan. Nagdudulot din ito ng kapahamakan sa babaeng nagpalaglag na. Narito ang plano ng pagkilos upang maiwaksi ang mali at hindi makataong gawain ng pagpapalaglag o abortion sa bansa. Ang plano ng pagkilos na ito ay nang naglalayong ipaunawa ang kahalagahan ng safe sex sa mga magkasintahan, ipabatid ang kapahamakan na maaaring makuha kung gagawin ang abortion, ipaalam ang kasong maaari kaharapin sa oras na gawin ang abortion, ipaintindi ang paggamit ng mga kontraseptibo sa mga mag-asawa at mag-partner upang hindi magkaroon ng unexpected pregnancy. Mga hakbang na dapat isagawa: magkaroon ng seminar at talks kung saan maipapabatid sa mga kababaihan, lalo na sa mga kabataan, ang peligro na maaaring mangyari kung ikaw ay magpapalaglag. Ayon sa Guttmacher Institute, nasa 1,000 Pinay ang namamatay taon-taon dahil sa komplikasyon ng pagpapalaglag. Bigyan ng sapat na edukasyon ang bawat babae at kanilang mga partner na mayroong alternatibong paraan o contraceptives kung hindi pa handang mabuntis. Libre lamang makukuha ang mga contraceptibong ito. Kaya dapat gumawa rin ng hakbang ang Department of Health or DOH para sa information dissemination. Kailangan ding ipabatid na ipinagbabawal sa batas ng Pilipinas ang paghitil ng buhay ng mga sanggol kahit na nasa sinapupunan pa lamang ito. Dito na nagtatapos ang video na to. Maraming salamat po sa panonood. Sana po lumawak ang pag-unawa nyo tungkol sa usapang abortion. Maraming salamat po.